Welcome to Med-Surg Mini number 14, HIV. HIV stands for Human Immunodeficiency Virus. This is a virus that without treatment has a prognosis of 5 to 12 years. With treatment, you can live a full lifespan. It can develop into acquired immune deficiency syndrome or AIDS, as well as other multiple complications such as malnutrition, TB, malaria, and other diseases. It is transmitted sexually through IV drug use or blood exposure or through breastfeeding and childbirth. Its diagnosis is based on CD4 lymphocyte counts. Stage 1 would be 500 or more cells, stage 2, 200 to 499 cells, and stage 3 would be less than 200 cells. The pathophysiology is that it compromises the immune system by destroying CD4 cells. These CD4 cells typically help to create T lymphocytes, such as helper cells, and as a result, since we don't have that, the helper cells can't activate B lymphocytes or T lymphocytes, leading to opportunistic infections, such as AIDS and other illnesses. Forms of HIV infection starts off as asymptomatic chronic, which lasts for about 10 years. Then we see symptomatic chronic, which lasts for about 2 years, and then development into AIDS. Symptoms of HIV infection includes dementia, night sweats, fatigue, lymphadenopathy, pain, vision changes, headache, breathing difficulties, skin lesions, forgetfulness, dysphagia, diarrhea, nausea and vomiting, weakness, cough, and fever. In addition to the CD4 measurement, we can also diagnose it through blood tests for antibodies. If we suspect that there's been some form of exposure and the antibody test comes back negative, we can repeat it in 3 to 6 months. The CD4 cells are measured every 3 to 6 months for the first 2 years of treatment, and then every 6 to 12 months after that. Common comorbidities with HIV and AIDS is hepatitis B, hepatitis C, TB, and syphilis. Complications is that it can lead to opportunistic infections, liver disease, kidney disease, diabetes, high cholesterol, and certain types of cancer, such as cervical cancer. Nursing problems include risk for infection, imbalanced nutrition, risk for fluid volume deficit, knowledge deficit, anxiety, grief, and ineffective coping. Treatment for HIV is first and foremost prophylaxis, so educating our patients on safe sex, needle safety, wearing proper PPE for ourselves, and we can provide antiretroviral therapy for anyone with a suspected exposure. We would want to treat any opportunistic infections, and for HIV itself, we can provide them with antiretroviral therapy or ART therapy. This may be done with a single medication or in combination therapy. Many of the medications end in VIR. We also want to make sure that our patients are up to date with their immunizations, and live vaccines are contraindicated. We know that treatment has been effective when the lifespan is not impacted, when we have reduced risk for spread, when they have knowledge on the symptoms and complications, and we would typically want to see the decreased viral load within 6 to 8 weeks of starting ART therapy. And that wraps up our discussion on HIV.